What advice would I have for someone with spinal stenosis who wants to practice yoga? For the answer, stay tuned. Spinal stenosis is a condition in which bony changes to the vertebrae induce compression of either the spinal cord or spinal nerves, or the cauda equina, the end part of the spinal cord in the lumbar region, which can cause pain and numbness and tingling and other symptoms. Now, often spinal stenosis is caused by osteoarthritis, just plain old degenerative arthritis, when osteophytes, or these bony growths on the vertebrae, compress spinal nerves and cause pain and other symptoms. The student who wrote in fact, has a yoga practice which she has been finding to be very helpful for her spinal stenosis. So I definitely think yoga can be useful, but you need to take some precautions. She does do back bends, but finds that poses like locust pose, shalabhasana, and bridge pose, Setu Bandhasana, these practices cause some difficulty for her, some pain for her. And generally, that's not surprising. Now, her spinal stenosis, like most people's, is in the lumbar spine, the lower back. It's also possible to get it in the cervical spine, the neck. But her case is in the lumbar spine. The fact that it's back bends that are causing her difficulty suggests that the problem is happening in the back of the spine. Now, if you saw the video I did on using forward bends in osteoporosis, I talked about the spine, and often the problems with forward bends are due to compression of the front of the spine. Because when you do a forward bend, the front of the body gets shorter and the vertebrae can get compressed there and cause compression fractures. In spinal stenosis, the problem is often in the back and to the sides where the nerves exit the spinal cord. And at that point, when you're doing back bends, then the back of the vertebrae come together, and that can compress the spinal nerves. Hence the caution with back bends in spinal stenosis. Now, I think often the best way to determine what's going to work, beyond whatever guidance a CAT scan or an MRI might provide, and it probably is advisable if you've got this condition to get that kind of confirmation of exactly what's going on as best they can tell. But you're really, in your yoga practice, going to want to use your careful, mindful experience to guide you in your practice. Now, this student is able to do some gentle back bends, but it's when she lifts the hips off the floor, as in bridge pose, that she really notices the problem. So undoubtedly, she's arching the lumbar spine too much in that situation, and her body is telling her, no, please don't do this to me. And so my suggestion is to pay attention to that. Now, it's possible that you could do a bridge pose and only come part way up, and that might work. This is the kind of thing that you can experiment, ideally under the guidance of a seasoned yoga therapist or other very experienced teacher who can guide you. But if you're very plugged into your own experience, I think you can allow your own experience also to guide you. Okay, forward bends are often quite helpful because forward bends compress the front of the vertebrae but open the back, creating more space in the back where the spinal nerves come. So that can be excellent for people with spinal stenosis. Twists sometimes can be helpful. Sometimes they'll work on one side but not so well on the other side. if the spinal nerve that's getting compressed is only on one side. In general, axial extension, in other words, creating more space between the individual vertebrae, can be very useful. So we can get that in a good downward facing dog pose, Adho Mukha Svanasana. We can get it in a headstand if we're able to do headstand well. If the weight is getting compressed in the spine in headstand, it can be bad. So here's a situation where the same pose could be good or harmful depending on how well you're able to do the pose. If you're able to do headstand lightly with good axial extension, creating space between the vertebrae by really firmly engaging the legs, you indeed may be able to do that pose and it may be therapeutic. What I like to do is to actually do a hanging headstand where you have ropes that are mounted on the ceiling or mounted on a door or somehow set so that you can set up a sling and have your body weight supported by your pelvis, and then you get traction on the rest of the spine, and that creates more space, more axial extension. Can be very, very nice for people with spinal stenosis. And of course, learning to sit, learning to be in just a seated pose, learning to stand, all with a good amount of axial extension can also help. We want to be cautious, err on the side of safety, and listen to our body and what it's trying to tell us when we choose our yoga practice. Okay, well, I wish you so much luck. Take good care. Namaste.